My name's Justin Marney and I'm the owner of At Home Dental. Well, originally I'm a Scouser by birth, and then I went up the M62. I qualified in Manchester in the early 90s. Then I joined the Royal Navy and I served for about 7 years abroad in Gibraltar at sea in the Middle East. And then I went off and I travelled and I set up in practice in New Zealand, and I worked in New Zealand for a couple of years. And then about 2000 I came back to the UK and I came down to South Devon in Dartmouth, and over the next 18 years I set up 4 dental practices, and we had a staff of about 90 and we saw about 30,000 patients in total amongst the practices. And that basically was my journey until I set up At Home Dental in about 2016. So when I was in the Navy, obviously I was taking a lot of dentistry to the sailors. So we used to do mobile dentistry. So that is, I suppose, where the seed of At Home came from, is the fact I was very used to working on ships in confined areas. I would go down to the dockyard in a mobile van or in a dental caravan, and we would look after the ship's company. I've been flown by helicopters onto oil tankers in the middle of the Indian Ocean to take out teeth on sailors in toothache. So, I suppose I'd always had an interest in the other side of dentistry, the more interesting side of dentistry, out of the 4 walls of a traditional surgery. And I suppose that's how we arrived at the whole idea of At Home Dental. I think one of the nice things about At Home Dental for the clinicians and the staff, it gives them an opportunity to get out of their 4 walls, out of a surgery environment and into the community, and actually treat patients and clients who may struggle to get to a routine dental practice. And that's very exciting. It's very exciting for us. It can be quite a routine career as a dentist. You stare at the same walls day in, day out, looking down people's mouths. And actually the stimulation of going to different places during the working day is brilliant. And that's, one of the key elements of why we enjoy doing our job so much. Back in 2010, I really was formulating the ideas of developing a service that would take dentistry into people's homes. There was a gap in the service delivery of dentistry. People who struggled to get to the dentist were not served at all. Domiciliary dentistry has traditionally been a very basic service at best, and people were falling through the cracks in terms of service delivery. So I then spent basically 6 years thinking about how we could provide a dental service that was of surgery quality but in people's homes. I've got very many inspirations in terms of service delivery of dentistry and how it can be achieved. And I think it's really interesting when you look at Formula One. They can change their tyres in 3 seconds. EasyJet can turn a plane around in 20 minutes. I can set up a dental surgery in your home in 5 minutes. And I think that was probably the game changer for me, of realising and taking inspiration from other organisations about how they do things very efficiently and using the right equipment in order to set up a surgery in your home. The equipment that we use in At Home Dental took quite a few years to source and to develop. So we use US military mobile dental chairs that they use out in the field. We went to Japan to source our actual dental units, which have electric motors in them and aspiration, and they're portable and they're high tech. We also went to Switzerland for some of our machines which have better mobile battery life in them as well. Also, in terms of administration, we embraced the cloud. So now we keep all our notes in a cloud-based system, so when we come to your home, We have everything to hand, all your x-rays, all your photographs, all your notes, and we put everything onto the cloud as well so we can access them every time we come to your house. The great thing about at-home dental is that we are going into your home or your workplace or the place you live, and that changes the dynamic. It is a far more relaxed atmosphere. You are in charge when we come to your house, and that is nice. And actually, as dentists, we don't like working in a surgical environment where people are nervous and tense and there's a quick turnaround of patients and they're in and they're out. And actually coming to people's homes make them more relaxed and funnily make us more relaxed. You know, we can take our time, we can get to know you, and we can get to understand the problems and issues you have. So I think from our perspective, and all our clinicians enjoy that opportunity to get to know our clients and understand their needs. And as such, we do run a very empathetic service. We have a series of patients, but basically we have people who have mobility issues. So they struggle to get out of the home physically. We have people who have travel issues. They've stopped driving. Maybe the public service, bus service in their area is poor, or it's difficult to get taxis. Often people who used to be able to get up the 3 or 4 steps to the practice or go up the stairs in their old Victorian practice in town start struggling to get in and struggling to get out. So we address those people. Also, there are people who have issues, maybe mental health issues, or they're agoraphobics, or they are very anxious out in the community, and they much prefer us to come to them. In addition to that, we have people who work very hard, who may be working from home now, who are in front of a computer all day, and actually going to the dentist takes 3 hours out of their life, whereas us coming to them takes half an hour out of their life. So at home dental, we want to make it affordable for everybody. So we do charge a service fee, which basically covers our travel to you and then back to base. This is a very reasonable amount, and it would be about the same or probably cheaper than you'd pay for a taxi to go, or for the parking fees if you were to park outside a normal town car park. After that, our fees are very comparable to the sort of dental fees you'd have in the high street. At Home Dental are really proud that we've taken basic domiciliary dentistry and actually created a service which is almost completely surgery-like in its operation. As a result, we can take x-rays, we can take intraoral photographs, we can do fillings, we can make dentures, we can take out teeth. We can do basically all the treatments you'd expect in a surgery. Some of the more complex treatments, maybe extensive aesthetic work, or something like implants, which can be more complicated, we then have people we could refer you to. But in general, we can cover 95% of your dental needs in your home. One of the great things about at-home dental is the fact that we can help people who may not have been helped in the past with dental problems. So for example, recently we had a phone call and the lady in question said she was struggling to speak, she was struggling to eat, she had real pain in her mouth. And that afternoon we went off, and she was quite an elderly lady. Unfortunately, she was bedbound, and there was no way she would have been able to access any dental care. We went along, and actually she'd broken a tooth which was very sharp and was rubbing on her cheek, and she had a huge ulcer on her cheek. And we smoothed it over, we put a filling in there and she had immediate relief. And you know, that's what makes the difference when on a Friday afternoon, it's the difference between somebody having a nice weekend or somebody having a painful weekend. So at Home Dental, traditionally we started down in South Devon. So that's our spiritual home. And we go from the borders of Dorset up to Somerset, basically covering the whole of South Devon. But in addition to this, a couple of years ago, we moved and we've got a base in the southeast. And that basically covers South London, Surrey, West Sussex, Hampshire, the New Forest, and parts of Berkshire as well. And over the next year or two, we're hoping to expand the service maybe into East Sussex, Kent, and up to Oxfordshire and West London as well. At Home Dental are really excited about what we offer to our staff, to our nurses, to our receptionists, to our drivers, to our clinicians and dentists. It's very different to a traditional dental practice, and this is what attracts staff to us, because it gives them the opportunity to get out of the surgery, to do things which are a bit different to what they're used to. A lot of our dentists and therapists and hygienists, they often work for us for maybe 2 or 3 days, and then maybe work for 2 or 3 days in a traditional surgery. And that portfolio of jobs keeps people invigorated, keeps them very happy and satisfied. And we encourage people to not only work for at home, but also to work in traditional dental surgeries as well. I think the service that we run has had its challenges from when we started 4 years ago. We thought it was going to be very simple. You get in a van, you go to somebody's house, you treat them and you go away. But it is difficult, and it is a logistics business. It just so happens that we do dentistry. So the challenge for us is service delivery, turning up when we say we're going to turn up, letting you know if we're running late, reminding you the day before, also making sure our days are efficient, that we're not wasting too much time on the road, that our route planning is good. And these are the challenges, but we've risen to the challenges and we are getting more efficient. And we are embracing technology to make sure our days are well organised, that we turn up when we say we're going to turn up, and we carry out the treatment in an efficient and cost-effective manner. So the sort of technology we embrace is we have software which can route plan the day, so that it makes the most efficient route journey in terms of timings and fuel efficiency and congestion at certain times of the day. Also, we have trackers in all the vans that allow us to understand where each van is at any time. If there was an emergency or an accident, it completely alerts us to the problem. But also it allows us to, if one of our dental vans is running late, we can phone ahead and we can say they are 20 minutes away, we know where they are, they're on the way. So embracing that technology allows us to keep everybody informed. And at the end of the day, communication is key to a successful business. We believe that at-home dental is for everybody. It is not just for the elderly, it's not just for people who may struggle to leave the house for whatever reason. It really is for the whole community, because sometimes it isn't easy for people to visit their own dentist. They may struggle to get their own dentist. They may be new to the area. So we can meet the needs of everybody in the community. And we have seen several families where we go and we see mum and dad and the 3 children all in one visit. So that's far more effective. They don't have to do several runs from school. We've seen generations, we've seen grandparents, then we see their daughters, and then we see the grandchildren. So really we are a full service serving the whole community. I think one of the nice things about our service, obviously it's the zeitgeist. You know, you're a click away from a meal, you're a click away from having a sweater delivered or a pair of shoes delivered. And I think dentistry has the ability to be a click away for you as well. It's not the end of dental surgeries. Dental surgeries are still a very efficient way of delivering dentistry, and people still want to go to their dental surgeries. They have dentists that they've seen for many years, and that is fine. But we offer an alternative. Maybe somebody is just unwell or has mobility issues for a short period of time, and we can step in. We don't have to be your regular dentist, but we can step in when you need us, and we'll be there for you. One of the interesting things about our service is the fact that when people have used our service and maybe they thought they were just going to use us for a one-off, they then really like us and they like what we do and they have us back, and we go back and see them for 6-month checkups, and several patients now we have seen since we began, and they are return and repeat customers, and we're very happy to have them on our books. So you don't have to have a dental problem to use us. It can be purely for a checkup and just for your routine dentistry. As a dentist who worked in surgery for over 25 years, I understand the strain of clock watching, of having a patient every 15 minutes, every half an hour, every hour, of having a waiting room full of patients, of maybe running late because somebody has turned up 10 minutes late who you couldn't turn away, and before you know it, it's a very stressful day. The nice thing about at-home dental, when you work for us, there is very little stress. We are in control. We do not have precise timings of when we're going to see people. We have timings which are a time window, which takes away a lot of the pressure. You also, if the appointment's going to take you longer, you've got time to do that. There is no rush when you work for at-home dental. Also, because we are a service, patients are using us as a service. They're not using clinicians as individual dentists. So also when you're a dentist or a therapist, sometimes you can feel owned by individual patients. When you work for at-home dental, that goes away. You're working for at-home dental, your days are relaxed, and it is the service who take on the responsibility for looking after the patients, not you as an individual.